The main take-home point of this article is that primary care providers should be able to identify high-risk women by taking a good family history and being aware of breast cancer risk factors. A low number of women are being offered endocrine preventative medications for breast cancer when we know that there are more women who are eligible to this. My name is Liz Gilman. I am an assistant professor of medicine and a consultant in the breast diagnostic clinic at Mayo Clinic in Rochester. The name of the article is Preventing Breast Cancer Through Identification and Pharmacologic Management of High-Risk Patients. It will be appearing in the April 2021 issue of Mayo Clinic Proceedings. Recent updates have been done to the U.S. Preventative Services Task Force recommendations regarding endocrine therapy, as well as American Society for Clinical Oncology guidelines, suggesting that we are able to offer more women preventative therapy for breast cancer. This can be done using Gestalt methods that don't take much time in the clinic for primary care providers to be able to offer their patients this therapy. Included in our manuscript are tables to help guide primary care providers in which medications might be best suited for their particular patients based on their medical history. Additionally, we've included charts to help guide discussions regarding risks of these medications. Oftentimes, it's a quick calculation to determine if the risk outweighs the benefit, but then there still needs to be that discussion about the risks and adverse effects of the medication. Using a woman's family cancer history and breast cancer risk, we're able to quickly identify those patients who might benefit from additional screening or preventative therapy. Breast cancer risk includes age at menarche, the number of pregnancies that a woman has had. Family history is very important, particularly number of first-degree relatives with breast cancer or any first or second-degree relatives with premenopausal breast cancer. These women are at higher risk for breast cancer and may benefit from taking this endocrine therapy. Endocrine therapy for premenopausal women is primarily with tamoxifen. Multiple options exist for postmenopausal women, including aromatase inhibitors, which block the peripheral conversion of androgens to estrogen, as well as tamoxifen and its cousin raloxifene. Raloxifene and tamoxifen also have the added benefit of being able to increase bone strength in those women at risk for osteoporosis. Women who have biopsy-proven benign disease that puts them at a higher risk of breast cancer, such as atypical ductal hyperplasia or atypical lobular hyperplasia, tend to have the greatest benefit from these medications. Women with a family history also benefit greatly from these medications. It is unknown whether or not women with BRCA1 and 2 mutations would benefit, and those who have had mantle radiation between the ages of 10 and 30. These studies have not yet been done. These medications are typically taken as a 1 pill a day for 5 years. There has been a recent study published out of Italy that was looking at a lower dose of tamoxifen. The standard dose of tamoxifen is a 20 milligram dose taken for 5 years. Low dose tamoxifen is a 5 milligram dose taken once, and they studied it for 3 years. 5 milligram tablets are unfortunately not available in the United States. However, we do have the opportunity to take 10 milligrams every other day, which has shown in vitro to be just as effective as 5 milligrams daily. Many women opt for this option as it has lower side effects compared to the standard dose or 20 milligram tamoxifen. In the article, we have laid out the current guidelines for endocrine therapy for prevention of breast cancer. We have also identified the women at risk for breast cancer and quick ways to help determine which women are at risk. We've also been able to help guide conversations regarding risk factors. Thank you for attention, and I hope that the article will help you to manage your women in your practice.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.